I am Lavi, the holistic health coach from the Plated Plant online. And the Plated Plant is a plant-based nutritional counseling company. We focus on helping people lose weight and reverse chronic disease through health, nutrition, and lifestyle changes. So I am a holistic health coach, and I've been coaching people for about 7 years now, teaching them how to change their lifestyle and make small changes, incremental changes to their lifestyle to improve their health, to improve their appearance, to skyrocket their energy. And tonight we are talking about autoimmune diseases. And so I'm just going to give a couple minutes to let people in, but I'm going to get started. And this is going to be a really quick talk. But I want to talk about autoimmune diseases because they affect a lot of people. 1 out of 6 Americans have some sort of autoimmune disease, and there are common ones that people have heard of, but a lot of them folks really haven't heard of. And what an autoimmune disease does is your body essentially begins to attack itself. Your immune system, which is designed to fight off offenders, bacteria, viruses, and antigens, different things in your body that attack your body. Your immune system is your defense mechanism. So it's designed to fight those off. And an autoimmune disease is one where your immune system is just not functioning properly. So like I said, autoimmune diseases affect 1 in 6 people, and they affect mostly women. So 90% of the people who have autoimmune diseases are females. They're women, and they are usually Black, Hispanic, or Native Americans. And I find it interesting. There was a study done that shows that the same antigens, the same mechanisms that your body has designed to fight malaria is the same one that causes lupus. So I found that really interesting because those people groups that are found in areas where malaria is common, which would be in African area, parts of Africa, parts of Asia, they have the mechanism to fight off malaria. Yet those same mechanisms have been associated with lupus and other autoimmune diseases. And so there's 2 types of autoimmune diseases. There are the type that kind of suppress your immune system, and that's like HIV or Candida. And a lot of people are familiar with HIV. It's a common term, but really what happens when someone has HIV is their immune system is suppressed, and so they're more susceptible to infections and viruses kind of getting out of control without their body being able to check it. And on the other side, on the flip side, other autoimmune diseases that you might be familiar with, like rheumatoid arthritis, psoriasis, Hashimoto's, type 1 diabetes, even lupus, those things are a result of an overactive autoimmune disease. And autoimmune diseases, and I keep fixing my hair. Now, autoimmune diseases, they don't just come up by themselves. They don't just come out of nowhere. You may be genetically predisposed to having autoimmune disease, but really autoimmune diseases are a convergence of several things that affect your body. So genetics are one of them. Environment is another one. And also, and when we say environment, that's your built environment. That's the environment around you. That's societal, but it could be the chemicals in the air. But it's also what you're putting into your body. So we're looking at a convergence of all these things, and then a development of autoimmune disease, which is really interesting, especially for people with type 1 diabetes, because what you see is children develop that at a really early age. They develop that before adults do. And, they develop that in childhood. Type 2 is usually developed in adulthood, but they develop it in childhood. And you might think, man, they must be genetic. But really, with autoimmune diseases, when the infant is in the mother's belly, what is in the mother's body, some of those things pass on to the baby, and it can get into the baby's body and affect the child's development. And that is probably the case with type 1 diabetes. There's a blood-brain barrier in our bodies, but in an infant, that is not really fully developed. So there's a lot of things that the mother can do that will impact her child. So her environment, what she's eating, what she's surrounding herself with, when her stress levels go up and different chemicals are excreted in her body, all of those things can affect the child. And if you are genetically predisposed to a certain autoimmune disease, then definitely the child can develop it. And so rheumatoid, I'm just going to go through really quickly some of the autoimmune diseases that people might be familiar with. So rheumatoid arthritis, of course, is pretty much your immune system attacking your joints. And that can be in your hands, your fingers, your arms, your legs. You might know people who are swollen or crippled. This develops over time, and it usually appears later on in life. But with rheumatoid arthritis, not always, but sometimes with rheumatoid arthritis, as well as other diseases, what you are seeing is a result of an event that may have happened, some sort of trigger that may have happened, and then you see this, you see the development. The person might start having symptoms over time. They might not know what's wrong. They might feel fatigued, tired, losing weight. There's no real way to pinpoint what's wrong. The doctors might run blood tests and might not discover, exactly what's going on. And then over time, as the condition worsens, then they're able to see what's going on. But a lot of autoimmune diseases kind of start out the same way, with the feeling of tiredness, feeling of fatigue, either weight loss or weight gain, depending on what the autoimmune disease is. But what science kind of reveals is it's an accumulation. And so the same thing with the baby in the womb, it's an accumulation of not only their genetic predisposition, but whatever the mother is having. Okay, so rheumatoid arthritis, psoriasis, which affects the skin, Hashimoto's, which is pretty much like an attack on the thyroid, which leads to hypothyroidism, lupus, and lupus really affects a lot of Black women. It starts appearing in the 30s. However, it can affect anyone, but you see it mostly in Black women. You'll see like the butterfly rash, there's a lot of inflammation, kidney disease, all of these things are components of it. And what an MS as well, muscular sclerosis, and that affects, the nervous system. Alopecia is actually an autoimmune disease, which affects the skin. And so I made a skin cream the other day, and the skin cream helps combat, helps soothe and helps heal some of the effects of those autoimmune diseases as they come out in the skin. So we have 7 channels of elimination. One of those channels of elimination is skin. So if you're sick, if you have a disease in your body or any condition, it's going to come out through your body one way or another. It's going to either come through your lymphatic system. It's going to come out through your excretory system. Your skin is one of those things that reveal what's going on inside of your body. Sorry, guys. So the cream that I made will help soothe that, will help reduce the inflammation, but really you have to treat the root cause of the autoimmune disease. And really, to treat an autoimmune disease, you have to do like a complete reset. And there's a doctor, he's very famous, and somebody's going to tell me his name. If you guys remember, put it in the comments. But there's a doctor who's been working with patients who have type 1 diabetes and has actually been able to help those pancreatic cells start producing insulin again. These are people who have had, whose pancreas cannot produce insulin, but he's been working with them, and they've figured out a way to get the pancreas to start producing insulin through nutrition therapy. Okay. And so it's possible to reset your body and put it in the best position for optimal health. And that is what I do as a nutritional counselor. I help people reset their bodies, put it in the best condition possible so that it can begin to heal itself, because your body will heal itself. It's designed to heal itself. Whenever you get a cut, you start bleeding, you're not going to bleed out forever. It will eventually heal itself, unless, of course, you have some sort of autoimmune disease. And that's what we want to focus on tonight. And so have my little notes here. Another thing that most people have in common who have an autoimmune disease is leaky gut. And you might not realize that you have leaky gut, but what leaky gut is food particles that are undigested are actually leaking out of your gut into the bloodstream. And see, your body is going to start reacting to those proteins and those molecules that it's not supposed to be reacting to, because you should not have that undigested food there. And so what happens is people start developing food sensitivity or food intolerance. So it's not necessarily an allergen yet, but that food sensitivity leads to your body beginning to attack those molecules and essentially attack itself. So if you are at the beginning stages of this autoimmune issues that you might be dealing with, and you don't know what's going on, you definitely want to take some blood tests and find out, what are my food sensitivities, what are my food triggers, what are some food allergens, because they're not necessarily really common allergens. So you want to get some blood work done and eliminate those things from your diet. Another thing, that if you have an autoimmune disease, you want to eliminate inflammatory foods. So inflammatory foods are, of course, junk foods, right? Fried foods, sugary foods, white flour, things of those natures. But there's also nightshades are inflammatory. So your nightshades are eggplant, tomatoes, red bell peppers. Nightshades actually produce or cause inflammation in the body. And you want to avoid nightshades if you do have an autoimmune disease. Now, there are some foods that you want to eat, some sulfuric foods you want to eat. These are also cruciferous vegetables that you want to eat. So broccoli, cabbage, Brussels sprouts, as well as garlic, onions. You want to eat those in very large quantities. Those foods really cannot hurt you unless you're dealing with gas. So you want to prepare them in a way so that you're not dealing with bloating or being gassy, but definitely lean heavy on the garlic, lean heavy on the onions. And I have my little list here. I just want to mention some things that are really good for autoimmune diseases, as well as specifically for lupus. So you want to also increase your vitamin and mineral intake. So you can supplement. You can supplement with vitamin C. You can also supplement with vitamin B complex. Zinc is really good. Folic acid. And then I left off asparagus as one of those foods you want to eat. And also you want to make teas or tinctures. So if you can drink certain teas on a daily basis, dandelion tea, echinacea root, kelp, red clover, alfalfa. These are really good foods that you want to incorporate into your diet, or, make beverages out of them on a daily basis. Now, one of the things about autoimmune diseases and the autoimmune diet, so if you are looking to reverse or reset your body using diet, one of the things you have to bear in mind is that the inflammatory foods like meat and processed foods have to be cut out of your diet completely, or you are going to find that you are not making any progress or very little progress. Dr. Gershon, he did work with patients for a long time, and he developed a protocol for helping people reverse their autoimmune disease. And the studies, their findings show that individuals who start and then kind of start letting those unhealthy foods get back in their diet really undo all the work that they've done. So what you have to do is dive head first into healing your body. And once your body is healed and reset and able to function properly then it's at that point you will be able to know what foods you can tolerate and what foods you can't tolerate. But in the case of like celiac disease, when someone has a gluten intolerance, they feel much better when they cut out the gluten entirely. And then the moment they have it, then they have the bloating. So you can, in order to reverse the disease, you have to stop doing what it is that's causing it. You have to allow your body to repair and heal. So once your body heals, then it can begin to repair. And you're going to have a hard time making progress if you start with a detox and then you start, eating right. And then every week or every now and then you have a cheat day. You're doing yourself a disservice. The best thing you can do is go all in for several months, however long it takes, to get your body in the right condition, than to prolong it for a year with cheat days here and there and just not making any progress. Give yourself 30 days and then 60 days and 90 days and see if you feel much better. Now, if you need a list of autoimmune disease foods, DM me. You can also email mbscompletewellness@gmail.com, MBS like mind, body, soul, completewellness@gmail.com, or you can just send me a DM. Tell me what autoimmune disease that you're dealing with, what you've tried to do in the past, and I can recommend some foods or, a plan that you can do. But I always would recommend someone to join my 30 days plant-based group, because we start with a detox. We start with a 3-day detox. And if that needs to be extended for you, for your particular body, and if it's something you can do, then we would extend it and just help detox your body. So fresh fruit juices, fresh vegetable juices, carrot juice. If you're dealing with blood issues, beet juice, celery juice, cucumber juice, raw juices. These are the things that you need to kind of start detoxing your body. And we will do that for several days, and then we'll dive in with the foods that work for you and healing foods. So I just want to present hope to anyone who might be dealing with an autoimmune disease. And if you have any questions, I can't see anybody on the StreamYard, and I don't know about comments or anything like that. So if you have any questions, just send me a DM, and it would be my pleasure to assist you. So have a wonderful night. Once again, I'm Lavi Ray at The Plated Plant, and I look forward to hearing from you and helping you in any way that I can. Have a good night.